Let me paint a picture for you. You're living with chronic debilitating pain. You've got Medicare, and your plan covers a procedure that could bring you immediate and long-term relief, except that your coverage claim just got denied by AI. That's what's happening to many Medicare patients in several states, thanks to a new program by the Trump administration. At the start of the year, Dr. Mehmet Oz, appointed by Donald Trump to lead the Centers for Medicare and Medicaid Services, called CMS, it launched the so-called Wasteful and Inappropriate Service Reduction Model, known as WISER, which is interesting because the letters don't actually match. The agency says the program is designed to reduce spending on unnecessary care using what it calls enhanced technologies, including artificial intelligence and machine learning. Machine learning is a subset of AI that enables computers to learn from data and make decisions. These tools are now being used to review a pre-selected list of medical services that the agency says are most vulnerable to fraud, waste, and abuse. But what's actually happening is that vulnerable people are having their care delayed or even denied. As the Seattle Times explains, quote, that means patients seeking certain medical services now have to wait for a third-party tech company to give them the green light before they can get treatment. The wait for approval can be long and disruptive. The new program adds a first-of-its-kind layer of scrutiny for patients trying to get certain services, as well as for doctors attempting to provide care, end quote. Democratic Congresswoman Becca Balint of Vermont warned about this in September.
Over at the Center for Medicare and Medicaid Services, the administrator, Dr. Oz, yes, that guy, decided to curb waste. The government, he decided they should curb waste by letting the government use AI to decide if your medical procedure is really necessary. That means for-profit companies will use bots to deny care for seniors and working people and will get rich doing it at your expense.
Now, CMS told the Seattle Times that the agency monitors turnaround times and will, quote, refine the model as appropriate. Medicare primarily serves Americans 65 years of age or older, a population that is more likely to experience serious illness and chronic pain. In other words, the people who need timely care the most. So far, the WISER model has been rolled out in 6 states, Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. And there are plans to expand it nationwide and to apply it to even more medical services. But just a little more than 2 months in, patients say the impact is already being felt. Treatments that once took days to access are now delayed for weeks or even months or denied altogether. Treatments like those for spinal degeneration and severe back pain. Patients who spoke to the Seattle Times say the delays are, quote, robbing them of their quality of life, end quote. Joining me now is the technology journalist Jacob Ward. He's the host of the podcast The Rip Current and the author of the book The Loop, How AI is Creating a World Without Choices and How to Fight Back. I recommend everybody read this book. It's really, really important and timely. Jacob, my friend, let me ask you something. I would have thought, I've often made the case that you can hate AI for a lot of reasons, but I've always thought in the provision of healthcare and research and the, finding cures to diseases and things, it might actually be more helpful. How come AI being applied to this application in Medicare seems to be making things worse for people?
That's a great question, Ali. And it's true, so I'm constantly accused of being, of not accused, but, I'm a bummer at parties when it comes to this topic a lot of the time, because so much of the time I think about the trouble that AI gets us into. But one of the bright spots has been healthcare. You're absolutely right. You aim, a pattern recognition system at, a huge database of pictures of, discoloration on people's backs, and it can figure out which ones are cancerous and which ones are not better than humans can. I mean, it is an incredible tool for discovering new, chemicals you can synthesize. I mean, there's incredible stuff you can do with it. That's medical. This isn't that. What this is bureaucracy, right? And where people have imposed these sorts of systems on bureaucracy in the past tends to go very wrong. And that's because what WISER is part of a long tradition of basically experimenting on powerless people. That's really what this is. We have seen, since 2013, case after case in which authorities will look at typically a welfare system and do big experimentation on those sorts of systems because the people involved are powerless. It's a place you can make big mistakes and nobody can really push back on you. We've seen this in cases where California during COVID was spiking 1 in 10 unemployment applications because they'd bought an off-the-shelf piece of AI from Thomson Reuters and wound up, creating this just havoc in people's lives. And that's a case where you can't find somebody to get them on the phone and say, hey, the computer did this wrong, right? It's disenfranchising people while automating this kind of thing. And here's the real thing, Ali, I'll just say, there is an incentive mismatch here because the private companies that make systems like Wiser typically are paid more for the number of denials their system issues. So they are incentivized not to fix those kinds of mistakes because they make more money off them, Ali.
So I have dry eyes. I have a prescription that I get filled for that, and I've been getting it filled for a while, and suddenly it got denied the other day for no particular reason.
Oh, wow.
And I don't know whether it's AI or not, but I actually can't get a human to say, hey, I've been on this medication, the doctor says I should use it. What's the problem? You studied this. The idea that you use automation for this doesn't end up solving the problem in some cases. And I don't know, is that because sometimes you just need human intervention for someone to say, hey, Velshi's been getting these eye drops for like 5 years. Why did we suddenly stop? The machine maybe made a mistake.
That's absolutely correct. I mean, I just think we have this long tradition in the United States of believing that efficiency is a good enough reason to experiment on people live in the wild. And everything that we do in the private sector, right, is informed by the idea that you got to make money off of each step of the process of you trying to get the drops that you need, right? But in truth, that may not be a profitable thing. You may need somebody on the phone in such a way that people can get in touch. And so what we're seeing here, I think, is just, this is and there's the case of it, when it's something like I feel for you with the bureaucratic difficulty there. But there are people, I've spoken to, folks at the University of Baltimore, the law clinic there, they have to go in and appeal people who are being denied SNAP benefits, right? Housing.
Yep, that's right. I've got the resources to solve this problem. One way or the other, I've got the time and the luxury and the resources to solve this problem. A lot of people don't.
That's right. Those disempowered people are the people being experimented on first. And in this particular case, it's worth noting here, right, that Dr. Oz is talking about this as if somehow the efficiency will then convince people to trust a system like this. The studies show right now 31% of people over the age of 65 on Medicaid have no trust in, only 31% of them have any trust in a system like this. So that means you've also got somebody at home who's been denied their medical coverage, and they're totally demoralized and have no ability how to even appeal this stuff. So again, it's just experimenting on the powerless, which is a theme we've seen over and over again.
It's one thing to trust AI in a vacuum when it doesn't actually affect you, but if it's actually going to stop you from getting your prescription drugs, I suspect your level of trust is going to decrease. Jacob, as always, thank you so much for helping us understand this little slice by little slice. Jacob Ward is a technology journalist. He's the host of the podcast, The Rip Current, and he's the author of the book, The Loop.